Hina asks, there are fears of a second wave from doctors and those who are experts in the medical field. What are the contingency plans in place if a second wave was to occur? Well, I'm going to ask both Chris and Patrick to come in on this, but clearly that, a huge amount of work has been devoted to the possibility, of a second wave ever since the disease arrived in this country and indeed before, because our anxiety about the second wave has been very much at the forefront of our minds. We will obviously keep all sorts of measures in reserve, the local lockdowns that I talked about, the regional lockdowns, a national lockdown, of course, has to be, as it were, the response of the ultimate resort. We really don't want to do that again. So we will also be looking at other ways in which we can respond to the possibility of a second wave that reflect the vulnerabilities of particular groups and the prevalence of the second wave in certain areas, and we'll be bringing forward more detail about exactly how we propose to do that shortly. But I wonder whether Chris and Patrick want to say anything more about the second wave.
I mean, a second wave is something which everybody, I think, realises is a possibility. And in fact, we're beginning to see the possibility of some second waves elsewhere in the world, and this possibility will exist with us for a very long time. So we have to prepare for that, and there's a lot of preparations going on. Clearly, the best thing to do is to try and make that as unlikely as possible. And that's why the points that the Prime Minister was making about as the economy has opened up, all of us taking that extremely responsibly, sticking to the social distancing rules, sticking to the 2 metres if we can, 1 metre plus with mitigations if we cannot. All the other things that have been recommended, ranging from the simple things like washing our hands to using face masks on public transport, all of these things are absolutely essential. And if individuals, families, firms do not take them seriously, the probability of a second wave goes up very, very sharply. But there are, of course, also things, winter is one of them, which may work to the virus's advantage, even if we are, all of us, working incredibly hard. And we have to be ready for that possibility. And clearly there are plans, and as the Prime Minister says, they start off with dealing with local outbreaks, and then it is possible to gradually escalate. But what we want to do is minimise the chance and then deal with individual outbreaks as they happen.
Well, I completely agree. The key is to make sure that the COVID secure approach is across society. We all stick to it. It's particularly important as the measures are released now that we stick with the rules as Chris has described them. And that should be enough to keep this under control. But we'll still see local outbreaks. There will be an increase in local outbreaks. There's no question about that. And we need to be able to monitor and deal with those. And then we need to make sure that by keeping to the rules, we reduce any upswing nationally, and we try to make sure that as winter comes, which is the big risk, that we're prepared to be able to deal with it. So this isn't something that's gone away. It's something that's been suppressed, and we need to make sure that we keep it suppressed through living with the rules we've got for a more COVID-safe world.